Hello, ladies and gentlemen. It's Naija Health Doctor podcast. On today's episode, we have a vibrant and very eloquent gynecologist that will take us through today's podcast. Before we proceed, subscribe to our YouTube channel and follow us on all social media, Facebook, Instagram, and TikTok. Welcome, my guest.
Thank you very much. Good evening, everyone. I am Dr. Kemi Oshundara from the Department of Obstetrics and Gynecology, Naija College.
Who is a gynecologist, and why do we need a gynecologist in our society?
Thank you very much. A gynecologist is a doctor that takes care of women. You know, women are special beings. We have a lot of features in women. So many things that women have different from men. A gynecologist is someone that treats those special areas of women to ensure that they are in good health.
Thank you. What is the right age for someone to see a gynecologist? What's the first age?
There is no particular age that a woman should start seeing a gynecologist, because once you're a woman, you're a woman. From birth, there are some babies that when they are born, a gynecologist may need to review them. Like if they give birth to a baby now and then maybe they notice vaginal bleeding at birth, it happens. It's something we see sometimes, and you may actually need a gynecologist to review the baby to know what actually is the cause of the bleeding. Usually it's not something dangerous really, but of course you need the help of a gynecologist to reassure you and let you know whatever is going on and if there's any need for any tests. At any time, any age that a woman actually has a complaint that is related to gynecology, can actually see a gynecologist. We don't have a particular age.
Are period pain and heavy bleeding ever serious enough to need medical attention?
Having pain during menses can be from a lot of things. Sometimes it may just be normal for the person. It might just be the person's genetic makeup. It might just be due to some little hormonal changes, of course, that occur in the body during menstrual period. And some may be due to maybe if the person have uterine fibroids that is close to the inside of the womb, might be causing pain during menses. And sometimes you evaluate some patients and then you are not going to find anything that might be causing it. So in such patients, of course, you reassure, you treat their pains whenever they are in pain, and at times it subsides on its own. Usually most people, when they get married, they start having children, then the pain subsides. And then the heavy period, it also may be due to so many things, hormonal changes, like I've said. Even uterine fibroids can actually cause heavy menstrual bleeding. Many other things, even adults. Elderly people start having heavy menstrual flow that they don't have before. This is a gynecological case that need to be evaluated and be treated.
What are the early signs of perimenopause that many women miss?
Early signs of perimenopause, it varies from individual to individual. I may experience something now and it's because I'm approaching menopause. Somebody else may not experience it, but majorly we call that period climacteric. That's the interface between the reproductive year and the menopausal years. In this period, some women may experience what we call hot flushes. Everybody is fine with the weather, but there's somebody that is just sweating excessively. She's having hot flushes. She doesn't understand what is going on in the environment. Some people may experience that. Some, it may be mood changes. Somebody that used to be happy gets angry, gets sad. Before you know it, she's happy again. And all those things, they may be experienced. And funny thing is, a lot of women will not experience this. All they will experience is just menses being irregular. Today I've seen my menses, in the next 4 months I may not see it, and eventually it stops. And then when we say a woman has achieved menopause, the person must have stopped menses for at least 1 year.
Can menopause impact mental health and sexual desire? How do you help patients that navigate this?
Yeah, thank you. Yes, definitely. Menopause affects a lot of things. It affects mental health. Like I said, some people will experience mood changes. Somebody that has always been pleasant, we just discover that she's getting angry anyhow, not happy with people around. So that, yes, of course, there must be a solution to that. You must intervene. Also, in the sexual health, estrogen hormone that I said is declined in the body is responsible in women that makes them look this beautiful, this female shape, the feminine behaviors, and then the interest in sex. And now, if it's declining, definitely the libido will decline. They don't have interest again. A woman that is sexually active is no more interested. Of course, the solution, there is hormonal therapy. Some may not even need any intervention. Some may just need psychotherapy. And most of the time, it resolves on its own.
At what point should someone start to worry about fertility? And what are the first steps to take?
If a couple is married for a year, they are living together, they have at least 3 to 4 sexual intercourse in a week. With that, medically, it's okay. They are having adequate sexual intercourse. And then they have been together for 1 year and they are not able to achieve pregnancy. Then they should seek help. You'll see some people, 2 months, they are married, they are coming to the hospital, hey, I'm trying to get pregnant. No, you have not tried. You tell them, go for a year. Except in some cases, like maybe the woman is old, 35 and above, reproduction tends to reduce from 35 in women, not in men. So definitely, by the time a woman comes who is above 35 and complaining of infertility, no matter how short the duration of marriage is, definitely we have to start checking what could be the cause, because time is no more on that woman's side. Unlike a young woman of 25, 26, less than 30, and then they are coming within a few months that they got married, they want to get pregnant. No, tell them, go and try for a year and come back.
Doctor, let me ask from this side. What are some common causes of infertility in women?
Yeah, thank you very much. Causes of infertility in women, there are a lot of things. Like I said, it starts from a young age. The child that is in puberty, that is not well taken care of. More recently, last week was the World Menstrual Health Day. Yeah, so we always campaign, we always educate people about menstrual hygiene, because a lot of people have gotten infection during menses that are even giving them infertility issues. So hygiene is very important, especially as a child is growing up during menses. Hygiene is good, maintain good hygiene. And then apart from that, some people who have the infection, people will call it toilet infection. There's no toilet infection in medicine. No. We call it sexually transmitted infection. Some people say, I did not have sex. I don't know. But you know, cleanliness too. If you are not clean enough with your underwears, you may have those infections. But generally, medically, we call it sexually transmitted infection, and you are not well treated. Definitely, it may leave some impact. The people who have it repeatedly, some may not treat, some will just go somewhere, they don't even know, just give me anything they take. And the sexually transmitted infection is in the lower reproductive tract, in the vagina. Then it may ascend. The organism, when they grow enough and they're enjoying themselves, they go up through the cervix into the uterus, from there to the tubes. And then that may cause pelvic inflammatory disease. This may result into the blockage of the fallopian tubes. And then, because it's in the fallopian tube that the egg of the woman and the sperm of the man meet to fertilize and then become embryo that becomes the baby. Yeah. So if that tube is blocked, definitely there is no how fertilization wants to take place. That's why when you have an infection, please ensure it is well treated. You may need to do tests sometimes to know the particular organism that's causing the infection, so that you can be treated for that particular organism. Yeah, so there are so many other things. So there are people that have had pelvic surgeries. Hormonal imbalance too can actually cause polycystic ovarian syndrome. Is also part. That can actually cause infertility in women.
Wow, we are really on fire. You are giving it to us.
In some cases, we hear women saying they've treated infection several times and it's keep coming. You keep treating infection every time. What can you say about that?
If you treat infection, it's either it is not well treated, or the person is getting the infection again from somewhere. Okay, I have sexual infection, I'm treated, my partner is not treated. And usually it's the men that give women. If I'm only treated, my partner is not treated, definitely if we meet again, I will get the infection again. So it keeps recurring. Except if I'm treated, my partner is treated. Usually that should solve it. And then most times there may be need to do tests. You may be using one antibiotics, and definitely that antibiotics will not kill that organism. So that's why most times we do tests to check which organism is actually causing the infection, and then we treat the organism.
Let me ask another question, Doctor. What advice can you give couples that always blame their wife, and the husband don't want to go out to test himself? In Africa, we're used to this thing. If there's infertility, all the blames will go to the women.
It is always a woman. In the environment that we find ourselves, it is the woman that is always at the receiving end. Even if a woman have sexually transmitted infection, it is the woman that brought it on.
Yes.
The man is the one that brought it. I can say it anywhere. Usually, she got it from a man. The woman cannot just get infection. So, infertility is not only about women. In fact, 30% of infertility is from the male. We have been in a clinic before when I was attending to a couple. Definitely, it's a woman that will always first come to the clinic. Of course, the husband family might have started giving her some fire. By the time she comes to the clinic, she needs help, you do all the tests, everything is fine. We don't just investigate only the woman. When there's infertility in a couple, we will definitely test. Even if the husband does not come, the husband does not need to come. We give a form for husband to do seminal fluid analysis. And sometimes you may not find it funny that there is no single sperm. You know, it's the sperm that fertilizes the egg.
Yes.
That water that comes out is semen. So some people might just be water alone, nothing inside. It's apple. Some people, there may be sperm, but it's not up to the normal quantity that can be enough to fertilize egg. Some people may have a lot of sperm with poor qualities. Some, the morphology may not be okay. Some, they are not moving well. You know, there's a particular speed at which the sperm is supposed to even move to be able to fertilize the egg. It's not only about women. Yes, we have seen women that, okay, it's the woman factor that is the cause of the infertility. But men too, they actually they have some issues that may be causing.
How do you work with couples where the issue might be the male partner sperm health?
Okay, yeah, a lot of couples, it is the male that have issues. But you know, men, because of ego and then in our environment, man is the head of the house. I'm not the one that have problem. It is the woman that have problem. They feel they don't have any problem. I've seen a couple in clinic that the woman was fine. We've done all the tests. She's been begging her husband to do tests. The husband, eventually the man did the tests. By the time they came to the clinic, and me, if I see a man like that, I've seen the results. I know the results. I won't disclose the results in the presence of the woman. I will ask, do you want me to say this in the presence of your wife? Yeah, and then eventually he said yes, that I should go ahead. Of course, solemnly told them the result of the honestly, they separated, they went their different ways to leave the clinic. So most of the time we put eyes on the woman, but no, we need to check males too. I don't say it's the males, but let's check the two. There are times that it will be the two. The woman has her own issue that you need to treat. The man has her own. So when you treat the two together and everything is fine, then you achieve what you want. But you are treating only the woman. You don't know that you even have a lot of work to do on the man. So it takes time. So when we have men that have issues with their sperm health, there are special doctors that actually takes care of that case. We call them urologists. Like gynecologists take care of women health, urologists take care of men health. Most of the time it's the woman that will come to clinic. By the time we discover, oh, there's issue with the sperm. Okay, so you refer the husband to urology clinic, and there are a lot of good results. There are some cases where there's no solution. The husband's sperm cannot fertilize the woman. Either he doesn't have at all, or the sperms are not enough, or there's one issue or the other. There are a lot of intervention. We are in technology age now where we do assisted reproductive therapy, which a lot of things. There are women that is their eggs that have issue, or they are too old, they cannot produce egg. You can harvest egg from them. You can harvest egg from donors, collect husband's sperm and fertilize and put it back in the woman. The woman is pregnant. So many achievements now that even men with low sperm count, they can actually harvest that as low as it is, can be harvested. The good quality ones can be gotten to fertilize the egg. To us, you get a donor to donate the sperm and they have the babies.
What advice do you have for women that their husband have ED and they don't want to come out play?
The husband.
Yeah, the husband is saying, me, I don't have issue. You understand that kind of thing? I impregnate someone when I was in secondary school. So what you're saying is not.
Erectile dysfunction is a problem on its own. The man may not have erectile dysfunction and then finding it difficult to impregnate a woman. Erectile dysfunction is obvious. The man could not achieve erection.
Some men can say that because I have plenty things on my mind.
I'm tired.
It's
you know, men like to do that a lot. A lot of men do that.
Like it's because of work. You don't want to pay house rent. The school fees is there.
I'm thinking about a lot of things. I've read a lot. I've seen a lot. They say, okay, when they are in courtship, they agree that they are not going to have sex till wedding day. And then they are supposed to have sex. The man is turning his face away, and the woman is trying to pull. And days they have not. I've read a lot about. I've not seen any, but I've read. But you know, erectile dysfunction is sin. Just that a man that does not want to help himself will be denying it. If you really need help, you should know you need help. Say it out. and seek the help. Not that you have erectile dysfunction and you say, no, it's because I'm thinking of something. And then your problem will stay there. But if you speak out, they will say a problem is half solved. If your wife knows, I don't think a good woman will marry a husband that have erectile dysfunction, and then you just jump into the street and be shouting, my husband have erectile dysfunction. No, that would not make sense. But
women will cover them up. Like,
the worst a woman can do is, okay, she doesn't know what to do, she doesn't know which hospital to go, but you can confide in people. Women, we cover our husbands a lot.
Yes.
You will see women that the husband is beating like this, they will be telling you, no, he's a very nice man, he buys everything for me. So you can't see a woman that will go and be announcing that her husband have erectile. It is until when it's time to fight, the man does not want to actually agree. That's when they say it openly. And even the openly, they are going to say is most likely the husband's family, so that they will know it's not my problem, but it's your son. A man that have erectile dysfunction should agree. Just agree first that, okay, you have it. And then definitely you can seek help. And a woman, if you have anybody that is into healthcare, you can talk to them. Most women will even lie about it, that, hey, my brother has erectile dysfunction and then we are looking for a doctor. Yes, so far they are going to get somebody to solve the problem. That's very fine. So women are really supportive when it comes to that.
When treating infection, and they believe that, okay, I don't want to see a gynecologist, I need to see a pharmacist.
Yeah.
Is it okay? Like, maybe you believe that, what I want to do is not that much. Let me see a pharmacist. Which drug can you prescribe for me that will treat this thing?
Yeah.
Is it okay? Or as a lady, let's see a gynecologist.
If you go to a pharmacist, of course, they will give you drug.
Yes.
But the problem is the drug they give you, is it going to work for the infection? If somebody has vaginal discharge now and then you go to a pharmacy, they give you drug, definitely discharge stop. That does not mean that the organism is completely dead. And that's why it's important to go to hospital. You doesn't even have to be a gynecologist. You have vaginal discharge, a general practitioner can see you about that. There's one we call eye vaginal swab. They will take the sample from the vagina, send it to a lab where the sample will be tested, checked under a microscope, tested with some antibiotics, and then, okay, this is the organism that is causing this infection. This is the antibiotics that is working for it, that is killing the organism. By the time we check, the doctor will prescribe for you, you take it to the pharmacist. But you know, the pharmacist definitely will give you the drug. Of course, he has the idea of, okay, it could be this organism, it could be this organism, but you don't know which one exactly it is. Yeah, so get checked, do a test before you treat sexually transmitted infection.
We've learned a lot today, and we really appreciate you
for coming for this podcast, especially this episode.
My people really love this information that you put out there, and they will be glad
to call you another time.
Definitely.
Thank you very much.
Thank you very much.
And
for having me.
My people, always remember that health is more important than wealth. There are times you have money, but the money is useless. Take care of yourself. Don't play with your life. See you again.